an original.
From Story Studio Network.
Welcome to The Fatigue Fixer, the podcast where we get real about why you're so tired and what you can do about it. Every 2 weeks, we'll gather here for honest, heart-to-heart conversations about reclaiming your energy, your patience, and feeling truly at home in your body. I'm Dr. Sarah Vadeboncoeur, a naturopathic doctor, Menopause Society certified practitioner, Enneagram 3 entrepreneur with enough business ideas to last me 10 lifetimes, and a hockey and baseball mom. Over the past 15 years, I've helped thousands of women just like you cut through the confusion and finally feel like themselves again. And now, I want to hear from you too. Use the link in the show notes below to leave me a voicemail, to share your story, give feedback on an episode, ask a question, or tell me what's been exhausting you. And your voice might even make it onto the show. Together, we'll get to the root of what's really draining your energy and give you the tools, clarity, and encouragement you need to fix your fatigue. I hope you enjoy today's episode. Welcome back to The Fatigue Fixer. I am recording today's episode the morning after getting back from the Canadian Menopause Society conference in Montreal. I am so happy to report there were 600 doctors at that conference, gynecologists, lots of family docs, nurse practitioners. There were about 20 or 25 of us, naturopathic doctors, dietitians, and everyone in that room was excited and committed to providing better care to women in midlife. And I found it to be very inspiring to see so many physicians and practitioners who have dedicated their whole careers to helping support women in midlife, specifically through perimenopause and menopause. So today's episode is going to be about how we blame a lot of things on perimenopause and how maybe there are other things that we need to think about. But if you have felt frustrated in your journey, either in terms of getting someone to listen to your symptoms or to get someone to acknowledge that it might be perimenopause, I just want you to know that there is a lot of incredible work happening here in Canada and in the US as well. And there are lots of practitioners, you maybe haven't run into them yet, but they're out there. And so I left very hopeful about the future of menopause care for women in Canada. And it's so funny because going to Montreal, I had intended for this episode to be all about how we blame everything on perimenopause. And we are still going to talk about that. But something really funny happened while I was there that I want to share with you, which we'll also kind of chat about in this episode. So on the first night, I was just sharing a hotel room with a friend and colleague who's a couple years older than me. And as we were getting ready for bed, she starts putting on flannel pajamas. And I look at her and I'm like, "You are wearing flannel to bed? Aren't you going to die of heat?" She's like, "No, I'm going to be fine." I was like, if I wore flannel pajamas, I would die. Like I legitimately wouldn't sleep. I would overheat instantaneously. So she was kind of laughing. And then we're like setting up our side of the nightstand. And my side of the nightstand has my earplugs, my mouth tape, my eye mask, my mouth guard, and my supplements, which I call my downers, which are basically just different supplements to help tell my mind to shut the F up so I can fall asleep and stay asleep. And on her side of the table is literally a bottle of estrogel. She also has a mouth guard and some progesterone. And so she just started to laugh. She's like, if you need all these things to get to sleep, maybe could it be perimenopause? I'm like, no, I'm not in perimenopause. I'm like, as I'm putting on the skimpiest pajama you've ever seen in your life and cranking down the air conditioning in our room because I don't want to overheat. Meanwhile, at home, I go to bed with a fan 2 feet from my face blowing on full blast again so I don't overheat. I'm like telling her how I'm like, I sweat so much more, like I smell and I'm sweaty. And she's like, But she's like, but you're not in perimenopause. I'm like, no, I'm not in perimenopause. She's like, what's happening with your periods? I'm like, oh, well, my cycle used to be 35 days. Now it's closer to 30. And my period's pretty much just like one day. It's super light. And she's just looking at me like, girl, you are in denial. And I was like, yes, I understand what perimenopause is. I counsel women every day. But I realized in that moment that potentially I have been in a little bit of denial, and I have been managing a lot of the symptoms with a whole bunch of other things. And there's nothing wrong with that. But I was telling her how I felt like I needed to save HRT. Like I'm kind of saving HRT for when I really need it. And she was like, okay, but maybe you would just sleep better and not have to take 87 downer supplements at bedtime if you just took HRT. So this episode is still going to be about blaming everything on perimenopause, but I also want to include the flip side of the coin, which is that apparently some of us probably are assigning symptoms to a whole bunch of other things that could be perimenopause. So this can go in either direction. So as I said, when I was in this conference this weekend, I was so excited about the conversation that's happening in our healthcare system about menopause. And that conversation obviously is happening online. And one of the unintended consequences of that is that we have started as a collective to blame a lot of things on perimenopause. And if you follow some of the big influencers, they will put out these lists that literally have 150 symptoms that could be related to perimenopause. And so when you look at that list, you are invariably going to have one or more of those symptoms. So if you look at that list and you say, oh my gosh, I have 10 or 15 or 12 of those symptoms, you might think, oh, well, then it's definitely perimenopause. The problem is those symptoms, very few of the symptoms of perimenopause are unique to perimenopause. I would say probably hot flashes and night sweats, although those can be caused by other things like medication, especially if you've recently started, adjusted, or stopped medications. That can cause night sweats and hot flashes. So the things that are, probably a very clear indication that's perimenopause are things like hot flashes and night sweats, vaginal changes. But a lot of the other symptoms like weight gain, low mood, hair loss, fatigue, these could be due to a whole bunch of other symptoms that may be perimenopause, but they might also be something else. One of the things that I learned this weekend is that when women are in perimenopause, about 63% of them report not feeling like themselves more than 50% of the time. And some of the main symptoms that women report are fatigue, I see a lot of that, sleep disturbances, feeling overwhelmed, anxiety, and finding it hard to make decisions. Now again, these symptoms are very common in perimenopause, and they may be due to some of the hormonal fluctuations happening, which we'll talk about what's actually happening in a moment. But think about what's also happening when we're in our 40s. A lot of us have really high stakes work situations. We work really hard. A lot of us have kids in lots of different activities and sports. We are often or sometimes caring for elderly parents or other people in our lives. Like we are stretched very, very thin a lot of times in our 40s. So again, when things start to feel not great and you don't feel like yourself, we are so quick to blame our hormones. And I think we sometimes forget that we are existing in an environment that can make us feel very tired and not sleeping well and anxious and overwhelmed. So I want to give some stats on when perimenopause is actually happening for most of us, because I think there's two sides to this conversation. One of the things I see and hear a lot is that a woman in her early 40s will go to her doctor and describe her symptoms and ask about perimenopause, and sometimes is dismissed and told you're too young. And that's not true. perimenopause can start in our early 40s. In fact, we know that about 20% of women are in perimenopause at age 40. Now, the flip side of that statistic is that 80% of women at 40 are not in perimenopause. So again, if you're in your early 40s and things are changing and feeling not like yourself, of course we need to include perimenopause in our list of possibilities. But statistically speaking, 80% of us are not in perimenopause when we're 40. And in fact, the average age of early perimenopause, which I'll explain what that means, is 47. So if you are in your 30s or early 40s and noticing changes, it doesn't mean that they aren't related to hormones. They might be. They might also be related to a whole bunch of other things. And it is statistically unlikely that you are yet in perimenopause. So how do we know if we're in perimenopause? I think this is still very confusing for people to understand. So right now, our definition of perimenopause is based on something called the straw criteria, and it includes a few different things. But the main criteria that we are still using, for better or for worse, to determine whether or not someone is in perimenopause is her period and her cycle. I've talked about this ad nauseum, but I will just repeat it quickly. There is no blood test that will tell you whether or not you are in perimenopause. They can sometimes be helpful in very rare situations, but for the most part, there is no blood test that's going to tell us whether or not you are. And on the flip side, I have patients who get hormone testing from their doctors and then get told everything's normal, therefore it's not perimenopause. And that is also incorrect. You can have perfectly normal hormone blood tests in perimenopause. That is not what we use for a diagnosis. It's a clinical diagnosis, again, mostly based on your cycle. So early perimenopause, which can last a number of years, is defined as your cycle changing by more than 7 days in either direction, at least twice over the course of 10 months. Meaning, if I'm a 35-day girl, so my cycle historically is about 35 days, if I all of a sudden start having cycles that are 28 days or shorter, or I have cycles that are, 35 plus 7, 42 days. And when I say cycle, I'm not talking about bleeding for that amount of time. I'm talking about when my period shows up. If my period starts showing up more often than every 28 days, or it starts showing up every 42 days or longer than that, then I will officially have hit the criteria for perimenopause. So even though my friend was mocking me about being in denial, I technically do not yet meet the criteria for perimenopause. What I do meet the criteria for, and I think what a lot of us are experiencing, is something called the late reproductive period. Terrible names. I didn't make them. That's just what they're called. And late reproductive is when women notice changes, often in terms of their period, like I said. Either your period gets heavier or it gets lighter. And it might start showing up earlier or later, as I described, but it is not changing as much as that 7-day cutoff, which is, again, that kind of official entry into perimenopause. So a lot of us are blaming perimenopause on things when we are actually probably in late reproductive. And late reproductive means you are probably still ovulating fairly consistently. You're probably still ovulating most months, but you are starting to have some subtle changes in your hormones. They're just not enough to shift your cycle. When they become enough to shift your cycle again by 7 or more days in either direction, you are now officially in early perimenopause. Again, that can last for a number of years. And eventually, you will move into late perimenopause. Late perimenopause is when you have at least 60 days between your periods. So now your periods are less frequent. You will often start to go months without a period. And once you get there, you can safely assume that menopause is 1 or 2 years away, meaning your last period is probably going to be within the next 2 or so years. That is how we define perimenopause. It is not based on our symptoms, because symptoms can start at any point in that continuum, right? It can start in late reproductive. You can have hot flashes and night sweats and period changes and mood changes and weight gain and all of these things in late reproductive. You can obviously have them in perimenopause. You can have them in late perimenopause. And on average, perimenopause lasts 4 years. In Canada, the average age at menopause, meaning when your periods end, is 51.5. If we subtract 4 years from that, again, it makes sense that the average age at perimenopause is 47. Now, that doesn't mean that you can't get there sooner. You absolutely can. But again, what I'm seeing is women who are relatively young, who are experiencing symptoms, are blaming or assuming that it's perimenopause, and often are not being examined for all kinds of other things that could be causing symptoms, which I promise I will get to. I quickly want to mention 2 things, because these are things that we do generally a poor job of managing, and it can have huge impacts on a woman's long-term health. So again, average age of menopause is 51.5, but anything above 45 is considered normal, if you will. If you stop your periods before the age of 45, that is considered early menopause. And if you stop your periods before the age of 40, that is considered premature menopause. It's often also called premature ovarian insufficiency, because your ovaries essentially stop making hormones much sooner than they should. And women who go through premature or early menopause are at much higher risk for things like dementia, heart disease, and osteoporosis. So we need to make sure that if you are in that category, you kind of not must, but it's highly, highly recommended that you be on hormone replacement therapy until at least the age of average menopause, which again is early 50s. Okay? So again, if you are 41 and you're tired and you're gaining weight, and your period maybe has changed a little bit, but it has not changed by more than 7 days, you are not officially in perimenopause yet. However, what could be happening, like I said, is that you probably are having some hormonal changes. So what is actually happening to our hormones, right? We love to blame our hormones. We often hear the word hormone imbalance, which is a very non-specific thing that could mean a whole bunch of things. But what is actually happening to our hormones in perimenopause? So in those early perimenopause years, and also kind of in the late reproductive, which again happens right before perimenopause, we often actually have really high levels of estrogen in this part. And often we will start to have lower levels of progesterone. So this is often where this idea of estrogen dominance comes in. That's not a real condition, but I understand why people are terming it that way, because it can be true for sure that in parts of early perimenopause, you still have lots of estrogen in your system, but you don't necessarily have as much progesterone. And one of the things that causes a lot of the symptoms that we experience, whether it's mood swings, insomnia, appetite changes, craving changes, those are not caused by the amount of hormones that we have specifically, but it's caused by the massive rises and drops. So our brains don't love when one day your estrogen is super high and then a couple days later it plummets into the basement. Our body doesn't like that. And when we look at things like PMS, people who have the worst symptoms are the ones who have the greatest delta between their high and their low. So what I mean by a delta is if we looked at a graph and we saw the day of your cycle with the highest estrogen and the highest progesterone, and then we compare it to the lowest estrogen and the lowest progesterone, the women who have the biggest difference between those two are often the ones that are going to have the most symptoms. So again, if you are in late reproductive or early perimenopause, it's very unlikely that your estrogen levels are low at this point. You're probably still pumping out a whole bunch of estrogen, but you probably are starting to have lower levels of progesterone, which is often why in my practice, when women are in the earlier stages of perimenopause, I will often start them just on progesterone because they probably don't need estrogen yet. They're still making a whole bunch. They don't need extra. But that will change once you get into late perimenopause. So again, late perimenopause, now periods are super far apart, at least 60 days or 2 months apart. When you get into that stage, again, usually this is happening for women in their late 40s and early 50s. At this point, you are more in a low estrogen state. This is where we are more likely to see low estrogen symptoms. Again, the hot flashes, the night sweats, the sleep disruptions, the vaginal changes, the vaginal dryness. This is where it can often make sense to now add estrogen into the mix if you are using hormone therapy. That is what is happening in perimenopause with your hormones. One of the talks that I enjoyed the most this weekend was talking about how so many symptoms start in the late reproductive stage. Again, that's where I would put myself. I do not meet the criteria for perimenopause, but I do have symptoms that are happening. But the question that we always need to ask is, are those symptoms all due to hormones? Some of them probably are. And a lot of them probably are not. They're probably related to stress, lifestyle, habits, dietary changes, alcohol, relationship stuff going on. Again, we are sometimes really quick to blame our hormones and assume that our hormones are doing all kinds of wacky things, but our hormones are doing their very best given the conditions that we are creating for them. And a lot of that is influenced by, again, our habits, our lifestyle, our choices. So one of the things that I want to share with you, which again was a topic of conversation this weekend, is that especially in that late reproductive and early perimenopause, one of the presenters suggested that we start to think of perimenopause as mostly a time of sleep disruption or a sleep disorder, in the sense that a lot of the symptoms that we see in perimenopause are symptoms of disturbed or disrupted sleep. We know that weight gain can be caused by disturbed or disrupted sleep, mood changes, obviously fatigue, appetite changes. Like your sleep, if you are not getting good restorative sleep on a regular basis, is going to impact all these other systems. And then you're going to have symptoms in those areas that, again, we often assume are hormonal. And again, part of them might be, but part of it might be that we're not getting great sleep. And I shared with that, like my sleep routine, it's better than it once was, but it takes a lot of different parts that I need to follow in order for me to get a good sleep and sleep through the night. And we know that 69% of women in midlife experience sleep disturbances. So again, are your symptoms perimenopause, or are they symptoms of not getting great sleep? And what's interesting is when we look at sleep disruptions in midlife, the most common sleep disruption we see is that a woman can fall asleep no problem because she's exhausted, but she will wake up. She'll wake up at 2 or 3 or 4 a.m. and not be able to get back to sleep. And when we look at the research, that waking up in the middle of the night is only due to hot flashes or night sweats 30% of the time, which means that a lot of us are waking up for other reasons. Now, we can wake up for other reasons that are affected by hormones, but we might be waking up for other reasons because we're still having that glass of wine before bed that completely disrupts our sleep. We are all screen addicted. We are all rushing and busy and stressed and overwhelmed. So again, is it your hormones that are making you wake up? Maybe. Or is it that your brain cannot shut down and relax because of what's happening in the daytime? If you are listening to this and you are not yet meeting that criteria for perimenopause, but even if you are and your sleep is disrupted, my advice to you is that is the first place that I would encourage you to focus on. Before you worry about your hormones and optimizing your protein and your nutrition and all the different things, your strength training, we have to get you sleeping. Because so many of the symptoms that you are experiencing are likely either caused directly by sleep or worsened by poor sleep. And we'll never know how many symptoms are left until we fix your sleep. A lot of times when we fix sleep, a lot of things get a lot better, right? Sleep is that treatment that improves almost everything. Now, it doesn't mean that if you sleep well, you're not going to have other symptoms. But again, if you're not sleeping well, it's really hard for us to know how much of this is related to sleep and how much of it is related to other things. Now, stay tuned. I will be doing a whole episode on sleep. But one of the things that was brought up this weekend that I think was a good reminder for me, and also just something that I want to share with you, is that a lot of women are using progesterone as a sleep aid. And that's not actually what it is intended for. But it is a sedative. So a lot of my patients do love progesterone because it does help them sleep. But what was presented this weekend is this idea that taking a sedative, which is what progesterone is not the same as treating an actual sleep problem, right? Being sedated is not the same as getting proper sleep. And the other thing that was talked about was trazodone. Trazodone is a medication that is often given to women to help with sleep. It is actually not a first-line therapy for sleep, meaning we have much better sleep medications and we have new sleep medications that are non-addictive, do not have a lot of the side effects of some of the older sleep medications that we used to have. And that is actually a much better treatment for sleep. So if you are taking progesterone or trazodone for sleep, please don't stop taking them. But we need to look at other things to make sure that we're actually treating the sleep and we're not just sedating you so that you don't realize that you're not getting great sleep. Step number 1, we need to sleep, which is why I have a whole elaborate routine that does help me sleep. And again, when I start to get to the point where I actually am hitting those perimenopause, that is when I might look at something like HRT to help manage my symptoms. But I actually think I'm not there yet. But again, maybe that's the denial talking. The second thing I want you to do, if you are having symptoms that you are blaming on perimenopause, please, 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 please go get some testing. Because again, we often blame perimenopause when it's something like iron deficiency or a thyroid condition or insulin resistance or a sleep disorder. I have a list of 13 tests that I recommend to all women over the age of 40. And these are really great tests to help you figure out what's happening with your nutrient levels. Are you low in something? Your thyroid and your metabolic function. Because again, a lot of the symptoms, the fatigue, the cravings, the weight gain, the mood, like these can be due to other things that have nothing to do with perimenopause. If you want that list, go in the show notes and I will send you that free guide that you can use to bring to your doctor. The other thing that we need to keep in mind and screen women for in this stage are things like sleep apnea. Sleep apnea, and again, I will talk about this more in the sleep episode, it doesn't show up the same way in women as it does for men. So women are often under-screened and under-tested for sleep apnea, and there's an increase in sleep apnea in midlife, so we need to screen for that. There are, sadly, a lot of women who are really burnt out, and symptoms of burnout can also look a lot like symptoms of perimenopause. And then anxiety and depression go up in midlife, especially if you have ever had anxiety or depression in the past. But even if you have not, there is a critical window around perimenopause where we see a massive increase in mood disorders. So again, we need to make sure that you're being screened for all of these things so that you can receive the appropriate treatment. Now, if you've been trying to have this conversation with your doctor and you are not getting the answers you want, or you're feeling very frustrated, this is something that I do with my patients all the time. I send them for testing. We talk about what is happening with their symptoms to see whether or not they meet the criteria for perimenopause. We help them understand what is going on and then create a personalized treatment plan for them. So if that sounds like something that you want, we're going to take 30 seconds so I can share with you how we can work together to help support you through your perimenopause and menopause journey. Are you tired of being told everything is normal, even though you're exhausted and don't feel like yourself? You deserve better care than that. In my one-on-one practice, I help women just like you do a deep dive to figure out what's really draining your energy. Together, we'll get answers and create a clear, personalized plan to help you start feeling like yourself again. If you live in Ontario or the Outaouais region and you're ready for the next step, visit drsarahv.ca to learn more and book your appointment today. Because being tired all the time isn't normal, and you don't have to keep pushing through it. We've talked about not blaming everything on perimenopause. Step number 1, again, if you're not sleeping, you got to get sleeping. Step number 2, please get some blood work and get assessed, because sometimes it's not perimenopause at all, and it's something completely different. I want you to hear from one of our listeners about one of her patients who assumed she was in perimenopause, and through some testing found out that she actually had something completely different. So let's hear from her now.
So this isn't my experience because I wasn't the patient, but I had a patient once who she came in for menopausal symptoms, and she had your classic bloating, hot flashes, weight gain, difficulty sleeping, mood changes. And, at first I thought it was just menopause, but then talking to her more, I realized that one aspect of her symptoms, the bloating, kind of didn't match the timeline of other things. And she also had a bit of a history that hinted at maybe it being something more. So I actually sent her back to get H. pylori testing done, and it came back positive. Her GP put her on antibiotics, and that aspect of her symptoms was completely resolved. So just an example of a symptom that was categorized as menopause by a few people she had worked with that ended up being something else.
This is why it's so important for us to not blame everything on menopause and perimenopause, because, again, it is wonderful that we're having these conversations. It's wonderful that women understand the symptoms and know what to look for and are more informed. I am all for that. However, one of the unintended consequences of that, like I shared, is that we're just lumping everything that a woman is experiencing under that perimenopause bucket. And we sometimes are not looking at anything else, which means that we're going to miss things. And it also means that you might not be on the right treatment. And one of the things that I think most women don't realize, because hormone therapy is so popular right now and it's so in the conversation, and it is a wonderful tool for menopause. I prescribe it. I recommend it. I think it's wonderful. But right now, there are only 4 things for which HRT is Health Canada or FDA approved. And that is the treatment of hot flashes and night sweats, the prevention of bone loss for women who are at high risk for osteoporosis, premature ovarian insufficiency, or again, if women go through an early or premature menopause, and then treating the symptoms of GSM, which is the genitourinary syndrome of menopause. It's not approved to treat depression, fatigue, sleep, joint pain, preventing heart disease, diabetes, all of these things that are in our conversations. We are sometimes, again, we're quick to blame hormones, and then we're quick to assume, well, I'll just take hormone therapy and all my things will get better. Some of them might if you actually need it, but it's not a magic bullet. And we need to, again, look at all the other pieces of your health that are having a massive impact on how you feel and your experience. So what I hope you take away from today's episode is that even if you are in your 40s, especially in your early 40s, it is much more likely that it's not perimenopause than it is, especially again, if your cycles are not really changing. That doesn't mean it's not hormonal. You might be having hormonal changes, but you might also be having lots of other things. I cannot tell you how often a woman comes in thinking she's perimenopause, and what she is severely iron deficient and often insulin resistant. So those are some of the things that we need to be looking for. Again, perimenopause symptoms are not specific. So when you see that list online and you check all the boxes and you think, oh my God, this is it, this is the answer, it might be. But again, a lot of those symptoms are not specific. So we need to make sure that we are looking elsewhere. Get your sleep under control. Make sure you get testing to see if there is something else going on. And understand what perimenopause is, again, how we diagnose that. And make sure that you're working with a practitioner who is menopause literate. One of the things that I said this weekend, which I stand by, is that we would never accept for a family doctor to not know how to manage a normal, uncomplicated pregnancy. So why are we accepting that family doctors don't know how to manage simple, uncomplicated menopause? So that is one of the things that I shared in a table that I sat with other doctors and specialists from Ottawa. And I think that's part of what needs to happen. Now, obviously, that's not going to happen right away. But if you are not getting the care you need, please make sure that you keep advocating for yourself. There are wonderful resources on the Canadian Menopause Society website. I'll link to that in the show notes, as well as the Menopause Society, which is a North American organization. There are wonderful things and resources that you can bring to your family doctor or your specialist to help advocate for yourself. So don't be like me and maybe be in denial, but also please stop blaming everything on perimenopause. It might be that, but it might be something else. And I want to make sure that you are properly assessed and get the treatment that you deserve. Thank you for listening, and I will see you right back here in 2 weeks. I know your time is precious, so it means so much to me that you're here. If you enjoyed this episode, share it with a woman in your life who could use a little extra energy and encouragement today. It's a small way to show her you care, because we're all in this together. Wondering what the next step is? Find out what's really draining your energy by taking my fatigue fingerprint quiz at fatiguefixer.ca/quiz. You'll discover which of the 5 most common types of fatigue you're dealing with, like frazzled fatigue, where your body's exhausted but your mind won't turn off, or drained fatigue, where no amount of sleep ever feels like enough. Your results will include recommended labs to ask your doctor about, plus my top suggestions for habits and practices that can help you start feeling more rested, calm, and in control. Because here's the thing, being tired all the time isn't normal, and you deserve to feel like yourself again. And hey, if you've got a story to share, a question, or just something on your mind, leave me a voicemail. Your voice might even make it into a future episode. Thanks again for listening, and remember, it's not all in your head. I believe you, and we'll figure this out together. I'll see you right back here in 2 weeks.
This is SSN.
Story Studio Network.